All right, let's dive in. Today, we're talking about the official disease watch list. We're going to break down what a notifiable disease actually is, and more importantly, why this whole system is so crucial for every single one of us.
You've seen this happen, right? A single case of something like measles pops up, and suddenly it's all over the news. And you might think, isn't that a bit of an overreaction? Well, turns out there's a really powerful reason for it. It's all part of a system designed to stop a massive outbreak before it can even get going.
And here's the absolute key. Reporting these diseases, it's not just a good idea, it's the law. A doctor or a lab confirms a case, and they are legally required to report it to the authorities. That one phone call, that one report, it kicks off this whole immediate public health response. The best way to think about it is like a giant smoke detector, but for diseases, covering the whole country. Every single report is a beep, an early warning signal. It lets the experts spot patterns, track how something is spreading, and get in there to put out the fire while it's still just a tiny spark. Okay, so what kinds of things are actually on this watch list? Let's start with the stuff we can run into almost every day. I'm talking about diseases that spread through the air or in our food. So first up, we've got airborne diseases. You know how this works. Someone who's sick coughs or sneezes, and poof, a cloud of tiny infectious droplets. But for some of these diseases, those particles are so small they can just hang around in the air, almost like invisible smoke, waiting for someone else to come along and breathe them in. Kind of scary, right? In this list covers a real mix of airborne threats. You've got measles, which is ridiculously contagious. I mean, you can be spreading it for days before you even get the telltale rash. Then there's something totally different like tuberculosis or TB, which is a bacteria that needs long-term treatment. And even common viruses like RSV are on the list now, so we can get a better handle on how it affects the most vulnerable among us, like kids and the elderly. Okay, so from the air, let's move on to food and water. This next group spreads through what scientists call the fecal-oral route. Yeah, I know, it sounds pretty gross, but it's actually simple. It just means that germs from, well, get into food or water that someone else ends up eating or drinking. And get this, the number one most common gastroinfection on the list in Australia, it's probably one you haven't even heard of, Campylobacteriosis. And you know where it often comes from? Something as simple as undercooked chicken. This is a perfect example of why this system is so smart. By tracking all these cases, they can figure out where the contamination is coming from. This really shows you the incredible range this watch list has to cover. On one hand, you've got something pretty common like salmonellosis. A lot of us know that one from food poisoning. But on the other hand, you have something like botulism, which is super rare, but is a massive, life-threatening emergency. Both have to be on the list because public health has to be ready for everything from the common stuff to the once-in-a-blue-moon disasters. All right, next up, let's talk about threats that need a bit more direct contact to spread. So this is where we get into bloodborne viruses and STIs, sexually transmissible infections. Obviously, these don't spread just by being in the same room as someone. We're talking about direct contact with infected body fluids. And each one of these is watched for a slightly different reason. For hepatitis B, it's a lot about making sure the vaccine is working as it should. For hepatitis C, there's no vaccine, but there are amazing new cures, so tracking is crucial to get people treated. And then with HIV, the reporting is handled with extreme confidentiality, which is so important for protecting people's privacy while still getting the data we need. So what's the number one most notified STI in Australia? It's chlamydia. And the reason it's so important to track this one is pretty sneaky. A lot of people who have it don't show any symptoms at all. So without that mandatory reporting system, it could just spread silently, causing some really serious health issues for people later on. And then there are situations that are just heartbreakingly urgent. A perfect example is congenital syphilis. This is when a mom passes the infection to her baby during pregnancy. The consequences can be absolutely devastating. So you can see why every single one of those notifications is treated like an emergency. It's a race to protect that newborn baby. Okay, for our last category, we're going into the wild. We're talking about diseases that jump from animals to people. These are called zoonotic diseases. Yeah, this is where public health and animal health really collide. We're talking about things like Q fever, which is a real risk for farmers and people who work with livestock, or Ross River virus. You get that from mosquitoes, and it can cause this horrible, long-lasting joint pain you get from a simple bite or even a scratch from an infected bat. And that last one brings us to this quote, which is, well, it's chilling. When it comes to Australian bat lyssavirus, it says,
Infection is almost always fatal without post-exposure treatment. The stakes just don't get any higher. This is the perfect example of why a notification isn't just a piece of data on a spreadsheet. It is literally a life-saving emergency alert.
Okay, so we've looked at all these different threats. But how does just having a list actually protect us? Let's walk through how it works.
It's basically a 4-step loop. Step 1 is surveillance. That's just the seeing part, identifying and tracking where the diseases are. Step 2 is intervention. That's the doing part, the immediate response, like contact tracing. Step 3, prevention. This is where you use all that data for the big picture, like figuring out vaccination programs. And finally, step 4 is evaluation. You have to check if what you're doing is actually working, right? You monitor how effective the vaccines are and what the immunity levels look like in the community.
So when you put it all together, this whole system is about getting ahead of the problem. It's about being proactive, not waiting around to be reactive. It's really a shield designed to protect you, me, our families, everybody by stopping these threats in their tracks before they have a chance to spread. But that leaves us with one last really big question. This system is fantastic for tracking the threats we already know about, but what about the ones we don't know about yet? How does a system designed to watch for known enemies prepare us for the next brand new threat that's potentially just around the corner? It's definitely something to think about. Thanks for joining me.